Thank you, everybody. So I am Kevin Francis. I am a major health condition policy manager within Welsh Government. Here's what guides us in Wales. In 2018, we published this, Healthier Wales. And what we're looking for is person-centered approaches. We're looking for services that keep people well, not just fix them. And we want people to live the best way that they possibly can and to measure what matters to them. So last year, the National Clinical Framework was published, and it's about measuring our pathways, our networks, and focusing on quality. It's been mentioned a lot today. The other thing it does is it wants clinicians to have leadership, and that doesn't mean that you have to have a title. That means that you own yourself and your service, and you have a voice that needs to be listened to. The political will for change has been quick and amazing, quite frankly. About 3 years ago, when I was asked to look at the 3 national audits, I remember sitting in a room with Mike, and he told me, yeah, but no one cares about FLS. And the fact that I've had the minister here today with the chief executive and everyone else it was unfeasible a couple of years ago. So really chuffed that we're doing something. Best return of value of services. That sounds like it's money. It's not just money. It is about the value of the service for the person and the clinician themselves. We want you to have job satisfaction at the end of the day. We want you to feel that you're doing the job that you're meant to be doing, and not hamstrung by powers that be, if you like. We need to use the data from clinical audit and other data's PROMs and PREMs, patient experience and everything like that. And this has been the biggest change for me, is the burden of disease. So instead where you'd have major health conditions, which basically were considered important because of the levels of mortality, the numbers you've seen today show how important that FLS and MSK and pain, how many numbers of people are affected across Wales. So before COVID, the situation was I was given the task, we have to do something. So my first job was, I'm going to appoint INDA because that makes sense and it obviously works. But we had limited levels of stakeholders. We only knew who we knew. We weren't really being reached out to from the community. We looked at things from a medicalized model. How do we get people through the hospital as soon as possible and just fix their hip and see you later, thank you. We didn't sit anywhere. We were almost an orphaned area of policy where we didn't really have the right people to go and shout to. And because of that, it was limited progression of service development. Obviously, the pandemic delayed what I wanted to do, which was this a couple of years ago, but we're getting there. So where are we today? We have a wide range of interested stakeholders, and thank you all so much for coming. We're looking at it through the value-based healthcare, what matters to you, what matters to the person, and how do we get the best investment back. We have been placed within the Planned Care Board. That's huge. Probably not to anyone but me, but it is huge, and I'll go into reasons why that's huge now. And we have leadership, and I want to reiterate, not just INDA at the top or being your megaphone, it's every single person in here. So we are starting our group, and that will sit under the Falls and Frailty Fracture Audit Programme Strategic Group, very easily to say, which we established December 2019, so it hasn't necessarily had the drive that we need it to. That now sits within the Planned Care Board, and we've created MSK and pain networks which will work alongside. Now, the Planned Care Board has the minister, it has the health execs, it has the Welsh Government, and it has planning. It has all the people that we need to talk to, and that is such an important part. So instead of coming into our group in blue, coming together, coming up with the best ideas possible and having nowhere to go to, instead now we have that ladder above us that we can actually raise. To finish, key messages from the government. We are open, our ears are open, and we're here to listen, as I hope that you've got today. So first of all, please don't expect anyone to try and make these changes that you want to see for you. We've got to do it collectively. You have a voice and you have support, as I hope that's been shown today. Please use it. We're here. Our emails, our telephones are open. We want to hear from the clinicians. We want to hear patient voice. We want to hear from everybody involved, third sector, everyone. We're not just looking for issues. The database kind of shows us our issues as well as others. We are looking for solutions. We want people to come up with the right ideas. we're all on the same bus trying to get to the same place, and we might argue about which directions we go, but we're all trying to get there. So please just I just want to be clear that there seems to be no disagreement amongst us that we need FLS in Wales. So it's just, and we might disagree on finance and stuff like that, but we're going to get there. Just bear with it. And lastly, as we've heard today, we really want to make Wales the exemplar. We want to show off because we're small enough that we can make small changes and have huge results at the end of it. And as Anthony showed with the hip fracture, showed with the hip fracture database, that was the first thing that I was asked to look at. And with Anthony's help, we've managed to stop people dying. And that's amazing. That matters. And this will matter to everybody who is affected by it. So that's going to be the last presentation today. Inda's going to close off, but thank you all for coming. And I hope you've enjoyed it and I hope it's been useful. And yeah, please get in touch. Thank you very much.